The Senate Committee on Health, Education, Labor, and Pensions will please come to order. Today, we are meeting to discuss and vote on the FDA Safety and Landmark Advancement Act, or FDASLA, the Retirement Improvement and Savings Enhancement to Supplement Healthy Investments for Nest Egg, or the Rise and Shine Act, the Cardiovascular Advances in Research and Opportunities Legacy Act, or CAROL Act, the Early Hearing Detection and Intervention Act, or EDI, and the Maximizing Outcomes Through Better Investments in Life-Saving Equipment for Healthcare, or the Mobile Healthcare Act. While we are unable to have the executive session fully open to the public or for in-person attendance, live video with closed captioning is available again on our committee website at help.senate.gov, and if you are in need of other accommodations, please reach out to the committee or to the Office of Congressional Accessibility Services. Families in my home state of Washington and across the country desperately need the FDA to live up to its responsibility. They are counting on it to address the formula crisis. They are waiting eagerly for an update on COVID vaccines for kids. They need it to do more to fight fentanyl and the ongoing opioid crisis, skyrocketing drug costs, and so many other issues. And beyond these urgent challenges, every time families sit down for a meal, every time they get a prescription filled, they are putting their well-being in the hands of FDA's experts, which is why it is so important we work on this committee to provide the resources and authority to set FDA up for success and the accountability the American people need to rest assured FDA is fulfilling its important mission. I'm pleased to say the bipartisan legislation we are voting on today strikes the balance effectively with a wide range of ideas and reforms from members on both sides of the aisle. This is the most important comprehensive FDA legislation to come out of this committee in many years, and that is the result of hard work by my colleagues on both sides of this aisle. I'd particularly like to thank Senator Burr for working with me to ensure FDASLA not only reauthorizes the prescription drug, generic drug, biosimilar, and medical device user fee agreements, which provide the needed resources to the agency, but to include many other productive steps. Following so many alarming reports in the past of known carcinogens in products like baby powder, hairspray, and kids' makeup kits, and so many years of dietary supplement manufacturers making unsupported health claims without any serious FDA oversight, I'm glad we were able to work in this legislation to ensure FDA can, at long last, provide meaningful oversight to cosmetics and dietary supplements. Families in Washington State turn to so many of these products every day, and people deserve to know they are truly safe and effective. I'm very grateful to Senators Durbin and Braun for their work on regulating dietary supplements, and Senators Feinstein, Collins, and Baldwin for their leadership on cosmetics reform. Senator Kennedy actually began to work on cosmetics on this committee 25 years ago. I'm proud we're finishing it here today. It is also important to me we ensure FDA's approval process is driven by what is best for patients, not pharmaceutical companies, which is I'm glad FDASLA includes steps from Senators Kaine and Senators Collins to modernize the accelerated approval pathway, and steps from Senators Kaine, Hassan, Smith, Collins, Marshall, Cassidy, and Romney to make it easier for cheaper generic and biosimilar drugs to get to the market. These changes will help ensure FDA prioritizes patients and will help bring down healthcare costs, which so many families are struggling with. We were also able to take action in this bill to provide a path for safe prescription drug importation from Canada. This is going to be a big deal for families in Washington State and across the country who have access to safer drugs at lower prices. And I want to thank Senator Sanders for his leadership on this. We've also included language from Senators Warren, Grassley, Hassan, and Blackburn to set a deadline for FDA to issue a final rule on over-the-counter hearing aids. I am incredibly frustrated. It is taking FDA so long to take a step that will lower costs for millions of people across the country. So I'm glad we can include language in this bill that will require them to finally get it done. In addition to lowering costs, FDASLA includes several steps to help spur innovation for patients, like the VALID Act from Senator Burr and Senator Bennett, which will help support the next generation of medical products. This pandemic has shown how important it is FDA's regulatory framework keeps pace with medical innovation, which is why I'm so grateful to Senator Burr for his leadership in this bill to make sure that happens, particularly when it comes to improving and modernizing how we regulate tests, including COVID tests. And there are other steps in this bill from our colleagues on and off the committee to support innovation as well. Senators Kelly, Collins, and Sinema have worked to reauthorize FDA's Critical Path Initiative, that is a public-private partnership focused on improving how medical products are developed, evaluated, and manufactured. Senator Lujan has worked to provide for alternatives to animal studies for biosimilar products. Senators Casey and Tim Scott have included steps to support the review and development of drugs for rare diseases. Senator Reid has worked to support pediatric drug and device research. Also, I hope to continue working with Senator Bennett and Senator Rubio on a proposal to support cutting-edge pediatric cancer treatment. This is really important to families across the country. I'm also glad this legislation updates language from our bipartisan opioids bill in 2018 to increase safe disposal of opioids and other drugs that pose serious risks. I'm grateful to Senator Hassan and Senator Braun for their work on that. And I look forward to building on these steps with even more bipartisan progress in the mental health and substance use disorder package that we are working on right now. Because the opioid crisis is devastating our communities. I've heard from folks on the front line in my home state of Washington. They all need all the help they can get to stop the very real threat of fentanyl. So I'm going to remain focused on what else we can do here to save lives and keep people safe. And finally, this bill improves transparency and accountability at the FDA and helps the agency function more smoothly. I want to thank Senator Rosen and Scott for their work on provisions to enhance coordination on inspections at FDA. Senators Smith and Cassidy for their work to make our nation more competitive on the global stage and facilitate the export of medical devices. And Senators Smith and Marshall for their efforts to clarify FDA regulation of contrast agents, radioactive drugs, and over-the-counter monograph drugs. And Senator Burr and I have also worked hard to address FDA's workforce challenges by enhancing FDA hiring authority so it can better recruit the top-notch talent it needs to fill out its ranks and requiring it to put forward a workforce plan and report. As we continue to deal with the infant formula shortage, we have seen how crucial it is to have transparency and accountability at the FDA and in the industry, and that's what this bill delivers. I'm glad Senator Burr and I were also able to work over the last week to include steps to further address this by requiring a report from FDA to ensure it resolves the mailroom issues that hindered its response to reports of contaminated formula from an Abbott employee, and by including provisions from Senator Casey and me to require infant formula companies to notify FDA of manufacturing issues that are likely to cause disruptions of supply, and FDA to put forward a clear plan and to take concrete steps to get formula back on the shelves as soon as possible. Every new development we discover seems to make this whole debacle even more infuriating. Last week, we learned FDA and Abbott both heard concerns about formula manufacturing issues as early as February 2021, essentially a year before that recall happened. I've been pressing very hard for answers and action from FDA on this and have asked Dr. Califf specifically for a plan. I'm absolutely going to keep pushing to hold FDA and industry accountable so we can get answers on the formula crisis and make sure this never happens again. And the steps in this bill are an important part of that work. Overall, this legislation will make for a stronger FDA with more resources to carry out its work, more authority to oversee products families entrust their health to every day, and more accountability to guarantee FDA is fulfilling its mission and putting patients and families first. I look forward to passing it out of committee today and into law soon. Today we will also vote to advance the most comprehensive retirement package this committee has considered in a decade, the Rise and Shine Act, and not a moment too soon. The COVID pandemic upended our economy and with it the finances of so many people across the country, in my state and everywhere. Before this pandemic, A study found nearly 2 in 5 Americans would struggle to come up with $400 in an emergency. COVID-19 was exactly the kind of emergencies families could not afford. I've heard from people in Washington State who were forced to raid savings meant for their futures just to make ends meet. And then there are the countless people across the country who never had access to a retirement plan or were never even paid enough to make ends meet, let alone save for the future. Now families are trying to recover, all the while paying more at the grocery store and the gas pump. We need to help people get back on their feet. That's why I'm pushing for steps to bring down everyday costs for the basics: healthcare, childcare, gas, and more. And it's why I'm glad we were able to take so many steps in this bill to bolster families' retirement and emergency savings. On emergency savings account, this bill includes a proposal from Senators Booker and Young to help families put money away for an emergency so sudden expenses do not upend their lives in ways that undermine their finances for years to come. On retirement, it makes it easier for employers to offer retirement plans thanks to proposals from Senators Hassan, Hickenlooper, Cardin, Grassley, Lankford, Collins, and Portman. It makes it easier to manage plans thanks to steps from Senator Rosen, Cardin, Portman, and Tim Scott, and easier to improve participation by allowing for auto-enrollment, re-enrollment, thanks to Senator Kaine. In addition to helping companies set up traditional retirement plans, it makes it easier for people to establish new employee-owned businesses, thanks to Senator Sanders and Senators Moran. I'm also especially pleased it makes workers eligible for employer-sponsored retirement plans by expanding steps we took in the Secure Act, something I've been pushing for along with Senators Casey, Cardin, Portman, and Tim Scott. The Rise and Shine Act will also protect workers and retirees by providing much-needed information and transparency, and that includes reports, reviews, and other steps to ensure retirement products are working effectively, as they should be, and as they are advertised. Like proposals from Senators Cardin, Murphy, Lujan, and Portman on target date funds, efforts to de-risk pension plans, and how fees are disclosed to people. And it includes steps like the Inform Act from me, Senator Baldwin, Senator Smith, and Senator Cassidy, which will ensure people get the information they need when forced to consider whether to take a lump sum buyout and trade a lifelong pension for a one-time payout. Overall, this bipartisan package tackles a wide range of issues that will help families in my state and across the country get on solid financial footing. I want to thank Senator Burr and so many others for all of the hard work and thoughtful ideas that have gone into this bipartisan legislation. I look forward to passing this bill out of committee and working with our Senate and House colleagues to pass it into law, along with other steps to strengthen the financial security of workers, retirees, and families across the country. We will also be voting today to advance the Mobile Health Care Act, which Senators Rosen and Senator Collins have worked so hard on. We have seen this throughout this pandemic, how important it is we make a concerted effort to ensure this critical primary health care services are available to families across the country, especially in our rural and remote communities. The Mobile Health Care Act will get us closer to that goal by providing greater flexibility to community health centers so they can improve health care delivery and access for families they serve, families who often have very limited care options close to home. I know how important this bill will be to patients living in rural parts of our country, including my home state in eastern and central Washington state. So thank you both for your leadership here. We'll also be voting to advance the Carroll Act today, which Representative Barr championed in the House on behalf of his wife, who tragically lost her life to valvular heart disease. This bill will support life-saving research, education, and awareness activities on valvular heart disease, which according to CDC affects 1 in 40 Americans. I really want to thank Senators Sinema and Senator McConnell for their work on this legislation, which provides hope of new discoveries and treatments to help people across the country experiencing this condition. We will also be voting today on the Early Detection and Intervention Act, EDI Act. The bipartisan legislation will support research on hearing loss and strengthen programs that help detect, diagnose, and treat hearing loss in newborns and young children. It's really important that we get kids with hearing loss the care they need to grow and thrive, especially in their earliest years, and that we get parents the tools and information they need to support their kids as well. This bill comes from Senator Hassan, Hickenlooper, Portman, and Cassidy. Thank you for your work on this. Now, as I've made clear by now, the legislation we are passing today really represents a lot of hard work from a lot of our members on and off this committee and on both sides of the aisle. And it includes meaningful steps to make life better for families in Washington State, North Carolina, across the country. I'm really grateful for everyone who has worked so hard to make this markup possible. And of course, that absolutely includes the many members of my staff, Senator Burr's staff, and others who worked on all these bills. This has seriously been an around-the-clock effort, especially by my staff and Senator Burr's staff, and I want them to all know how much we appreciate it. Thank you to all of you. With that, I will turn it over to Senator Burr for his opening remarks.